You are welcome to our Masterclass Psychiatry Medicine series on pathological jealousy, and you are invited to subscribe to the link which is shown on YouTube for previous discussions and presentation, and for future presentation on various topics spanning from medicine through psychiatry through even topics on reflection, business, and name it. Pathological jealousy appears usually in the CASC examination in psychiatry, and usually the instruction is to assess the patient. And one needs to look at broadly the following areas: the nature, effect, and the insights, underlying disorders, risks, and discuss with the partner. Now, on the nature, effect, and insights, the relationship history is important, and the onset and progression of this condition, and the degree of conviction of the patient, and evidence available, whether there is evidence-seeking behavior, any aggression, whether verbal or physical, and the partner's confession and the circumstances surrounding that confession, any restriction of the partner's movements, and willingness to consider alternative explanation, and the time spent to think about it, his reasons for her infidelity. Underlying disorders needs to assess personality of the patient, affective disorders, if any, psychotic disorders, if the person paranoid, any alcohol or drug use, any obsessions. The third is the risk to himself, any self-harm, and risk to others, whether there is confirmatory behavior, identity of the lover that he suspects, any violent fantasies against the lover, history of violent behavior, any target, whether wife or children, or alleged lover or objects, reaction of potential victims, thoughts, plans, any weapons, alcohol use, forensic history, insights, and whether he's amenable to management suggestions. It's always good to discuss afterwards with the partner and find out from the partner reasons. We'll mention the reason for the interview, establish jealousy is central problem, confirmatory behaviors from the partner, like interrogation, any restriction of movement following searching, and the partner coping strategies and mental states, and role in any arguments, any risk determinants, any risk management, which will include reducing risk and improving self-protection. Treatment for morbid jealousy is that of the underlying cause: cognitive behavioral therapy, alcohol and drug treatments, rehabilitation depending on the underlying cause. The prognosis depends on developing insight and concordance with treatments in this condition. Thank you very much for your attention, and I wish you all the best in your career and also in your studies for those who are preparing for exams, especially the practical or the CASC in psychiatry.